morning, everybody, and welcome to the Capacity Tracker Masterclass webinar for care home providers. This session is to help you find your way around Capacity Tracker and to show you how to update your care home's information on bed vacancies and business continuity. Just before we do quick introductions, there were just a few items I wanted to raise. Number one, in London, I'm sure most of you are aware, we have two tools running simultaneously, Market Insight Tool and Capacity Tracker. I just wanted to take this opportunity to clarify the guidance, as I know that there has been some confusion on which tool to use. The national guidance is very clear. As we are at the highest level of a national emergency, all care home providers are required to input their vacancies and business continuity information into Capacity Tracker on a daily basis. I want to assure you that we are working on a solution to build an automatic feed from Capacity Tracker into Market Insight Tool so that you only have to input your information once. However, I can't give any timelines at the moment on when this will be ready. What I can clarify today is that in line with the government's guidance, care homes need to input into Capacity Tracker regardless of which other tool is in place in your locality. Secondly, this session is focused on how to update your information on Capacity Tracker. I recognise there will be questions on the National Infection Control Fund guidance and the new National Public Health England questions on outbreaks. Please would you kindly put your questions on the chat box if you have any specific queries relating to the guidance, and we will respond to you after the session. Thirdly, just wanted to also, just as a reminder for care homes around the Infection Control Fund and the requirements. For those, I think there are still a few care homes, just a very small number in London, who still haven't completed their Infection Control Fund return. Please could you action your return as soon as possible, and it has to be done on Capacity Tracker to be eligible for the grant funding. Secondly, just wanted to confirm with you, local authorities can only allocate money funding to providers who have updated Capacity Tracker at least once and are completing the tracker on a consistent basis. There is a cut-off date of the 26th of June, which is next Friday, for the allocation of the first tranche of money. So I urge those of you who have completed your return but have yet to update the tracker to do so as soon as possible. So let's get started on introduction. So my name is Sanjeet Johal. I work for NHS England and NHS Improvement for London, and I am leading on the rollout of Capacity Tracker for the London region. I've got a couple of my colleagues here today, Chris and Hassan, who will introduce themselves.
Hi, I'm Chris Larkin. I support Sanjeet on the rollout of Capacity Tracker in London. So thanks for joining, everyone. Hello.
Hi everybody, I'm Hassan. I work for NHS Next, supporting the London region in the rollout of the Capacity Tracker. So we work with care homes and also the local system champions across London to kind of work through any challenges that you might be having.
Okay, thanks guys. I don't know if Stuart's on the call today. No, he's not. Okay, that's fine. So this is a 1-hour webinar, and I'm conscious that there's nearly 200 people on this webinar, so that's amazing attendance, brilliant. And what we're going to do is we're going to try our best to keep to time to ensure that we've got plenty of time for Q&As at the end. And I know that there are some people who've actually dialed in as well, so they won't be able to use some of the Microsoft Teams functions. There will be an opportunity to ask questions at the end of each topic. But if you are on Microsoft Teams and you would like to ask a question, please use the Teams raised hand button. My colleague Chris will be manning the chat box during the session, and after each topic we will pause to take a couple of questions. Please note, if we are unable to get through all the questions today, and I know there's quite a lot of people on this webinar, so that's definitely not, we won't be able to respond to each question. We will be collecting all the queries at the end and we will respond to you after the session. Please also note this session will be recorded and we will share the link with you afterwards. Hassan, over to you.
Sorry, Sanjit, that was just having a couple of technical issues. Thank you, Sanjit. So first off, I'm going to run through how we update the information in Capacity Tracker, what it looks like for you, so I'll be mimicking a home, and also some of the new questions that have come up. We'll stop for a couple of questions, and then I'll run through what it looks like for a commissioner, as to kind of what kind of information they can see in terms of what the care homes have updated as well. So to get started, I'll just share my screen. And you should be able to see that. So when you first log into Capacity Tracker, this is the main menu that you'll see. And it has just a little bit of information around what there is available within Capacity Tracker. The best way to update is by going to the business continuity / vacancy updating providers, or you can click on this button here. I'm mimicking a home. I've got a user for a Manchester home, so hopefully not useful information to you guys. So this will pull up the information around your home, okay? And this is dependent on the kind of registration details you have included in the care home setup when you first signed up to Capacity Tracker. Initially, there is some information around the cost of the home and a bed. This is an indicative price, and the idea is, so when somebody contacts you from looking at Capacity Tracker, whether that be a social worker or whether that be an acute trust, they will have a rough idea what the cost is, but you will not be under any obligation to match this price. So if the price is higher or lower, you can then discuss that with whoever you come into contact with. There is some information around capacity and vacancies. So the number of beds you have, and then the number of beds that are unoccupied at the moment. Across London, there are some homes that have granted broker access, either to brokerages or their head office if they're part of a large chain. So broker access essentially allows either the brokerage in your local area or the large care home providers, their head office, to input information in terms of a bulk upload for all of their care homes. So depending on the access that you have provided and agreed to, then that will either say yes or no here. Okay. The first point that we're going to run through today is the COVID-19 recovery questions. So they came up last week. And you will have seen these pop up. So this is an ask from Public Health England, who will be monitoring outbreaks in care homes based on the response that they received to these questions here. So the questions are based on resident and staff count, and fairly self-explanatory. So the first number is the number of residents, the total number of residents that have...
Hassan, sorry to interrupt you. I don't think we can see your screen at the moment.
Oh.
I think it's...
Sorry, let me try again.
It may just be me, but I can't see it. So.
Are we back on?
Yes, it's back now. Thank you.
Thanks, Hassan.
Sorry about that, guys. So I'll try not to press any buttons. So these are the new COVID-19 questions that we have. So the top box is the overall number. So hopefully...
Okay.
Was that a question or?
Are we supposed to be, what we're looking at, the capacity tracker table, yeah?
Yes, can you see that okay?
Yeah, we've got it, yeah.
Perfect. So the top question, so whenever you hover over any question in Capacity Tracker, you should be able to see a pop-up that comes up and tells you what's required within that box. Okay. So the top box is the total number of residents that have COVID-19 either confirmed or suspected in the home. So either confirmed by test or suspected due to symptoms. And that's not just today, that's the total number that currently have ongoing symptoms or confirmed COVID-19. The second and the third boxes are the COVID-19 either suspected or confirmed today. So these numbers are reset every day at midnight. So there's an expectation that the boxes are completed every single day. So the second and the third box, the second box is around the suspected cases. So somebody that hasn't yet had a test, but they've got a new persistent cough, or something similar that makes you suspect that actually this patient now has COVID-19. So every day this box will need to be completed. The third box is for newly confirmed. So any new confirmed cases that are confirmed by testing. Okay. So there is a national kind of testing program that's ongoing. So if you're part of that, and a patient comes up that day, a resident with COVID-19, you'd put it in this box. Like I say, it would be it would be zeroed again every day. So every day you'll set back to zero. So it's dependent on, after that point that it's been zeroed, have there been any new cases? If they're not new, then that person will be added to the total in the top box.
Okay. I have a question. I'm calling from New Malden, Abbeyfield, New Malden. When you said the first one says overall number of residents with COVID-19,
yeah,
is since, let's say, the ones we had came as positive since we started the pandemic, the lockdown, I mean?
No, so it's anything that's active at the moment. So if a resident has had symptoms, been confirmed, but now has recovered, they wouldn't be included. So it's anybody that's active with the symptoms. That's a really good question. Thank you.
Okay, because I wasn't understanding.
Sorry.
Sorry,
go ahead, Priscilla. Go ahead, Priscilla.
Sorry, because from my understanding was since we entered in lockdown, or many residents in total, so it's just zero because we don't have any now.
Yeah, zero now if there's no active instances.
No. All right. Thank you.
Sorry, Hassan, I just wanted to remind everyone just to keep themselves, mute themselves because there is some background noise. And also, if you want to ask a question, can I just ask you to press the raise hand button on Microsoft Teams, please? Thank you.
Thank you, Sanjeet. So yeah, any active COVID-19 residents, not any historic ones. The last box that we have, sorry, the thing I was going to mention about the suspected and confirmed. So Public Health England have asked for these questions so they can measure and monitor outbreaks within care homes. So the agreed outbreak definition for Public Health England is 2 suspected or 2 confirmed cases of COVID-19 in a care home counts as an outbreak. But if there is anybody in your care home that does have suspected or confirmed COVID-19, it is still necessary for you to update your local authority or the people who have commissioned in that local area to see if there's any support that they can provide. So for Public Health England instances, they would class 2 as an outbreak. But if you do have 1, then please contact your local authority or your local commissioner to just advise them that there is suspected or confirmed COVID-19 in the home. When you complete these boxes, there's these 2 kind of statements at the bottom with 0 on and A at the bottom. They will auto-populate depending on what's been added into these sections here. So if you put 2 in the top one and 3 in the bottom one, then it will total it as 5. Okay. And then in terms of the bottom box, so if you say 2 days ago put in somebody as having suspected COVID-19 and then today they've now recovered, this box will now say on the 17th of June you had a suspected COVID-19 infection. But these 2 boxes will auto-populate depending on what you've been inputting here. So that's not something that you need to worry about. So this top box is for residents. The bottom box just below it is for staff. So again, suspected and confirmed staff. So if they have suspected, a new and persistent cough, then you would include that in the top box. If they've been confirmed with COVID-19, again, this is an active, not something in the past couple of months. If they have COVID-19 and it's confirmed with a test, then include that here. This is for staff working in the home. So it's anybody that's employed by the home, whether that be clinical or non-clinical staff, whether that be a manager or a carer or a nurse or a chef, that needs to be included here. If they're agency staff, then it doesn't need to be included. So it's only staff employed by the home, whether that be clinical or non-clinical, caring or non-caring, but employed by the home. Okay. And again, the bottom box here, total COVID-19 staff, will auto-populate again, depending on what's included here. Okay. There has been some issues in the past couple of days when it kind of went live last week around numbers being inputted which are really high because of some issues we had around the boxes and not being able to see the boxes. We now have a check in the system which kind of only enables you to include a number that is lower or equivalent to the number of residents you have in the home. So that was an issue that 1 or 2 homes in London had experienced last week, but that shouldn't happen again. So that's COVID-19 recovery, and they're the new questions that have come up. I'm just going to go through. Yep, sorry, go on, Sanjay.
Just a quick pause. There's a couple of questions. Hands up from Elizabeth O'Donovan. Elizabeth, do you want to unmute yourself? And she's still there. And Linda Krimgoltz. There's 2 questions.
You'll have to unmute yourself.
Okay. Yeah, you would have to. Okay. No, they're not coming off mute.
We've got a question from the chat box I can ask.
Okay, go on.
So Sharon Bai says the 4th box for residents, so the number of residents who are admitted from outside the care home, is that for new admissions from outside the care home, or is it for people who've come back from hospital specifically, or both?
Both. So anybody that's new, any new patient, whether it was a resident that you had previously or not, it's anybody that's admitted from outside the care home. So yeah, that's a really good question. Whether that be from a residential setting or otherwise, yeah.
Cool.
Anybody.
Thanks.
Thank you, Grace. Is there anything else on the COVID-19 specific questions?
So one more question about the staff this time. So what if the staff are bank staff and work in the home on a regular basis, or agency staff who work in the home on a regular basis? So they're not employed by the care home, but they work there lots of the time. Would they still be included or not?
The guidance that we've had is anybody kind of that's employed by the home. I'd say if they were working regularly and doing a lot of shifts, then potentially, but I will have to confirm that and come back, Chris.
Cool. Thanks, Hassan.
And Hassan, there was a question from Margaret, but I think she's put her hand down. No, that's fine. Continue, Hassan. Thank you.
There will be an opportunity for question and answers. So if there's anything that does come up, then we will get to it at the end. Thank you, Sanjeet, Chris. So I'm just going to run through some of the other questions that we've had in the capacity tracker for a while to just run through any questions and any queries that we have there. So the first one is around the current status of the home. So is the home open or closed? And that is a checkbox you have up here that would tell you whether the home is open or closed. Okay. That will then change the admission status here. So this home is open. The overall status is dependent on any issues that you have around operational issues in the home. And again, with hovering over the text boxes, and I will go through a user guide later on, it will tell you roughly what these RAG status means. So for green, there are no issues identified today in terms of the care home operating. Amber, there's operational risk being managed with some risk of deterioration in the coming days. And with the red, it's business continuity in place and or at significant risk of being able to accept further admissions in the coming days. So there's been many reasons why this has been kind of RAG rated differently. You know, for example, one of the homes had a flood. So actually that was the reason why they had to RAG rate differently. So there could be slightly different reasons, but it's not workforce or PPE. So that's again subjective to the issues that you're having in the care home. Just below that, we've got PPE. So in terms of the PPE, that's split into aprons, eye protection, eye and face protection, disposable gloves, fluid repellent / surgical mask, and hand sanitizer. And again, this is ranked as green, amber, or red. And this is a bit, again, self-explanatory with the pop-ups. So green, you don't have any issues. You've got enough supply of that particular aspect of PPE. With amber, so you've got supplies available, for example, in this case of aprons, but they're expected to run out within 7 days. So in the next week, they're expected to run out. And then for red, you're expected to run out within the next 2 days. So you've only got enough aprons to see you through the next 2 days. When you input this, and I will kind of show you what your local authority or CCG colleagues will see, but there is a report that they run which then tells them which homes are green, amber or red. But again, it's very specific. Red if it's under 48 hours, and then amber if it's within 7 days. Okay. There is further guidance on gov.uk around the use of PPE as well. And then on the right-hand side, again, one of the boxes that we've had previously for some time is around workforce. So this is around registered nurses, care providing staff, and non-care providing staff. This is full-time equivalents and not head count. So registered nurses, care providing staff, and non-care providing staff in this row, in this column, is the number that you have employed within that home. Okay. And then in terms of the second column, that's the number that are currently absent at the moment, whether that be due to COVID or otherwise. It's any absent staff that you have right now. And then the last box is any additional full-time equivalents that you're requiring. We know a lot of care homes are not running to capacity at the moment for various reasons, but this is a box that will likely be quite important as the NHS starts up again and we start using care homes again for discharges. So additional FTE depending on kind of the issues that you're having at the moment. So these are numbers. At the bottom, we do have a RAG status as well. So this is subjectively how your staffing ratios are being impacted at the moment. So green, operating within agreed staffing ratios with minimal risk identified in coming days. With amber, there is a significant escalation risk in the coming days. So you're okay at the moment, but you think that there is going to be some significant escalation risk in the coming days. So whether that be, some COVID-19 has hit the home and some staff are potentially have come into contact and you're expecting that to be an issue over the next couple of days. And then red, your workforce levels have been breached and your business continuity in place and you need significant support straight away. That's now, you need the support now. So, COVID-19 has hit and, staff are unable to attend the care home. You need support right now. Okay, and that is, again, a red will pop up for the local authorities and CCG, and they will be coming into contact with you guys to understand what that issue is. We are aware that some areas have been using these RAG ratings slightly differently. Again, just to confirm, green, you are able to staff at the moment and you don't have any issues. Amber, you are able to staff, but you expect some significant escalation risk in the coming days. And red, you're struggling right now. You don't have any staff to be able to see your residents.
Okay. Just a good moment to pause. There's a couple of hands up. Linda, do you want to unmute yourself? And also, we've got another question from Angus. Okay, I don't think they're unmuting themselves. Chris, is there anything?
Yeah, we've got a couple of questions in the chat box. One is from Angus, so I think that might be the one Angus tried to ask. So it's, we have some family members who are regular essential visitors for residents' personal care needs. So would you record them if they're symptomatic, either as residents or staff?
Again, a really good question. I would probably say not, but Chris, could you just note that down and we will find out and get that back out to you?
Sure. And then a question from Shafi who says, for PPE, the eyes face protection one, is there eye shields and goggles? So how do we ask for which one we need? Because they're separate things, but they're in the same category.
I think so. With the RAG rating, that should instigate a conversation with your local authority, CCG, and that's when you'd probably have that conversation at that point to say which one it is. None of these RAG ratings will probably mean that they'll put it in a box and send it to you. What they will mean is they will have a conversation with you, ideally. Okay.
Cool.
Thanks.
More questions. So Chris Cathina says, what do the download template and submit completed template relate to? Is that on this screen? I'm not. Oh, there we are. Yeah, right at the top.
I'm going to press the button and see what happens. Okay, so this is for bulk completion. So this is for we talked about broker access. Mm-hmm. So when brokerages. So again, brokerages or large care home firms that have many homes, they will download this template, fill in the template for all of their homes after contacting each home separately, and then they would bulk upload. So that's what that template is for.
Cool, thanks.
Thanks,
Another
Hassan.
question. So we're struggling with recruitment at the moment, but are able to meet the FTE required using agency staff. So would we rate ourselves green for workforce because we've got enough people, but they're agency?
I think that would still be green. I think
Cool.
So the amber and red at the moment is predominantly around significant risk, especially with COVID-19. So if you're still able to staff, if that's an issue around recruitment, unfortunately, that's not covered with it.
Cool. If someone's on annual leave, are they included in the absence figures, and so should they be in the box?
No.
Okay, cool. And final one, do you class the fluid repellent face mask the same as the normal face mask type R11R?
I would suggest yes, but again, it's dependent on your need and the interventions that you're carrying out. But yes, this would be any kind of mask that kind of covers the type that you need.
Brilliant, thanks. That's all the questions, but there'll be more opportunity to ask later on. But yeah, let's move on.
Yeah. Thanks, Hassan.
Thanks, Chris. We're just going to move on to the infection prevention and control measures questions that came up a couple of weeks ago, I think about 3 weeks ago now. So again, this was a national ask and it was related to funding. So £600 million of funding, which will be released to care homes. This was linked to that specific funding. So local authorities will be given funding to support care homes dependent on these questions being completed. So they're predominantly around how care homes are able to function through COVID-19. At the moment, it has been a one-off ask. The questions might be taken off, or you might be asked to complete them on a monthly basis. We're not quite sure at the moment, but at the moment, it's a one-off ask. The local authorities are required to complete a return next Friday, so they need all the information back to be able to access the funding for care homes. So the questions, I know there have been some issues around the questions. There is a support email address at the top, which allows you to ask questions. Ooh, I've had a pop-up. Peter Griffin, are you wanting to share your screen?
Oh, so sorry about that. It's a mistake.
Right, okay, I'll decline it. That's fine. So if there are any questions specifically about these questions, there is an email address and a contact number for Capacity Tracker, which I will go through later. But just for these specific questions, there is a contact email address here. So the questions are yes or no questions, and there's 5 sections. So fairly simple to complete. There have been a couple of issues. So I'm just going to run through the ones that some care homes have struggled with. So the first set of questions are around infection prevention and control measures. So around creating isolation beds, around confidence of staff, not moving between care homes, and about paying wages following a positive test. There is a question about government testing portal. Again, hopefully most people have signed up to that. Around COVID-19 test kits, I know most care homes have been receiving those, especially if they sign up to the testing portal. And yeah, so any patients that are discharged. There's a question around PPE, which again, so the new questions further up do cover that in a bit more detail, and then some around workforce support. Yeah, so fairly straightforward. If there's any questions, please pop them in the chat.
I think, Hassan, there's a question from Margaret Atterall. She's got her hands up. Margaret, would you like to unmute yourself?
Yes, I would like to, thanks for giving me the opportunity. I would like to ask in regards to the question about have you received the test kits? And given that, based on what our local authority says, we should be doing this weekly, and some weeks we don't get it. So is this question referring to just having received it the once, or is it meant to be updated on a weekly basis? Because some weeks things happen and we don't receive the kits. How do we respond to that question?
I think at the moment, Sanjay, correct me if I'm wrong. Can I just ask you just because we're getting echo back? Thank you. At the moment, Sandeep, correct me if I'm wrong. We are being asked to only complete this once.
Yes,
There
that's
is
right.
an ask and a conversation going on nationally around completion of the questions more regularly. But at the moment, nationally, the ask is only once. If your local authority has asked you to complete it weekly, then I will leave that up to your local authority because they might be using the information slightly separately to manage their flows.
Yeah, so the national ask is it's a one-off return. I'm not aware of other local authorities asking care homes to submit on a weekly basis, but it's a one-off return, certainly from the national teams. That's the guidance that's been given.
Thank you.
I think Lucy's got.
Can I clarify my question? I didn't mean that we had to submit the report weekly. What I meant was the testing kits. We've been advised that we will be being tested weekly.
Okay.
So
okay.
That's what I meant. Not that So when I'm doing that form on a daily basis, obviously the whole form comes up. But if there've been weeks when we haven't received a test kit, do I leave that as we've received a test kit, or just that's what I wanted to be sure.
I would suggest just leave it as yes, but we will confirm with the national team.
Okay.
I think Lucy's got her hands up. Lucy, would you like to unmute yourself and?
Yeah, hi, it's Lucy McCulloch and I work across South West London. I'm one of the system champions. I think this is a really good questions what are coming up here from the providers and the confusion around how frequently to update it. From our perspective, we can take that data daily as a daily update, so we can download that data. So we would really love it if you could update it as things change, because that does help us to understand what is going on. And particularly, I know there's a few comments in the chat about the clinical leads, and we know letters are kind of going out across our patch. And so I know at one point, your provider might not know who the NHS clinical lead is, and then they will find out. So we are looking at that data, and we are supporting our providers. So please do complete it. Thank you.
Thank you, Lucy. That's really helpful. And hopefully, I think Lucy's point is quite valid. This will hopefully prompt conversations which haven't happened before. So that's really helpful. Thank you, Lucy. Go on, Sandeep.
Okay, we've got one final. I'm going to just take one question from Michelle Cox before we move on to the next section. Michelle, do you want to?
Hi there. Thank you very much. It was really around further clarification as to the daily submission of the information to the capacity tracker. Depending on who you actually speak to, their interpretation of daily is Monday to Friday, but then other people have a submission of 7 days a week. And at the moment, I'm in the lucky position that not a lot of my information for all my care homes is really changing dramatically on a daily basis. So I have stopped doing this on Saturdays and Sundays, but I'm rather concerned that comments on the lines of this potentially could affect the future funding concerns me. So can we have final clarification? Is this Monday to Friday, or is this Monday to Sunday?
Yeah, and that's a great question, Michelle. And we've raised this with the national team, various national teams actually, about please can we have some clarity around what does it mean by consistency? We will chase again, but certainly this has been escalated to the national team, and it's also been raised by other regions in the country as well, where we need some urgent clarification. We will take that question again to the national team. Sorry, I can't clarify on this session, but it's certainly something that we raised repeatedly. So.
Okay, thank you.
Hello, can I say something?
Yes, of course.
Yes, my name is Anne Williamson and I'm standing in for the matron at St Vincent's Nursing Home. I do this capacity tracker every day from Monday to Sunday. That's what I've been told to do. Yeah,
and that's the national guidance daily. But we in terms of the Infection Control Fund guidance, we wanted some clarity around the wording around on a consistent basis, because we were also under the impression, and as well as other regional leads, that it should be updated daily. I mean, so it should be done daily, but I think there has been some mixed messages coming around about daily could mean Monday to Friday, but we need to go back again. But I think to be on the safe side, I would update daily, and I know that's difficult for some providers to do that on a weekend, but we will get some clarification for you.
Thank you.
Thank you, Michelle. That was actually the next point on my list to actually discuss. So that's really helpful that you've brought that up. It is daily at the moment. That is the ask. We just need some clarity further. But you're right. It should be daily. In terms of the update, the one point that I did want to make. So we've kind of run through that section. But the one point I did want to make is all of these questions are really quick and simple to complete. And I don't know if anybody's tried doing it on their phone, but actually it's quite simple to complete on the phone as well. It renders quite easily. So actually, especially once we kind of have some clarity on these questions, whether or not we need to complete them, we have tried it. We have asked care homes to time it. Some have said it takes no more than 2 minutes every day if they keep on top of it. So if we kind of build it into our timings and into our job planning each day, it should take no more than 2 minutes as you're flicking through on your phone. And yes, you can do it on your phone. So that was the only other thing that we had to add in there. I'm just going to run through quickly what CCGs, local authorities and STP colleagues can see. So hopefully you guys have an idea around what is available to them. There's a bit more available to me, so I know my screen looks slightly different now. So in terms of reporting, some of the main things that local authorities, CCGs and STP colleagues are looking at are reports around COVID-19. So for example here, I mean, because of my access, I can see the whole country, but there's a quick summary of COVID-19 across care homes. So for example, in London at the moment, as of today, there are 168 COVID-19 residents active, and that's confirmed and systematic for staff and residents. Okay, and then there's a separate box around the homes that have more than 727 have more than 0 cases, so 1 or more. And then there's a guidance around infection rates. So what does that look like for London as a region? Okay, so that's one of the COVID-19 reports that we can see. We'll quickly run through actually. So, and then we talked about outbreaks. Again, this is something that we can monitor through the capacity tracker. So again, your CCG, local authority, STP colleagues, we'll be looking at this. So again, for the home, they'll be able to assess when the outbreak start was, and then when the last known case of COVID-19 was. So some homes have had an active COVID-19 case and how long that's been going on for and whether that's ongoing or not. Your colleagues can also see how often care homes are updating. Okay, so this is, I'll just go by SDP, I'll go by London. So your colleagues will be able to see how many unregistered homes there are. We just load. So how many unregistered homes there are. So at the moment in North East London, there are 16 homes, and well done, South East London, you have 0 unregistered homes. So they're able to monitor which homes there are, and once they click on the information, they'll be able to tell which ones are registered. They'll also be able to tell which homes have registered and have never updated, and then separately which homes have updated in 24 hours, 48 hours, 72 hours, and 7 days or longer. So they will be monitoring this, and some of you may have already had contact from our contact centre, which have been getting in touch with care homes to help them through the process of registering and updating. Like I say, there is a big push nationally to be able to update this on a daily basis. And just to help that, there is a separate report which again lets your colleagues, if it loads, look at when the care homes have been updating. So for example, this care home didn't update for 3 days, then updated for 5 days, didn't update for 3 days, updated for 3 days, and didn't for another day. So again, this is not a kind of a punitive thing. It's around supporting care homes to be able to complete it on a regular basis. The one thing that is going to be a real help is going forward, trusts and social care providers will be looking for care home vacancies as we start up the NHS again, and patients have been admitted to hospital and now need to be discharged. And this is a screen that they use. So they input a postcode, they look for the type of care home that they want, whether that's long-term or short stay, and the type of bed type they need. They input a rough price range, and then there will be a list that come up, ordered by location, for homes that have vacancies. Historically, what has happened trusts have kind of got into contact with homes speculatively, usually homes that they have had previous contact with, to see if they have any capacity. The whole idea behind the capacity tracker is both trusts and patients and their families will be able to assess the kind of home they are, the cost, also whether they have vacancies and CQC rating, among other things, whether they have contracts in place, which is quite useful for social workers. So this is a reason why we're kind of pushing care homes to be able to complete this, especially as the NHS starts up again and we start discharging patients out of the hospital. This will be used, and we are getting into contact with acute trusts across the country to be able to for them to use this capacity tracker. I'll just complete, Sanjit, and then we'll stop for question and answers, if that's okay. The last bit that I really wanted to go through was the resource centre. So if you hover over help, which is the last tab, and then resource centre, there is information available. So there is a contact centre which will be able to handle any queries that you might be struggling with. The number is here. It's 8 a.m. to 5 p.m. The other thing I would suggest is getting into contact with your local authority or CCG system champion in your local area. They have direct contact with us, so we can escalate as well. So that's probably how to get into contact if you're having specific issues, either your local system champion or the contact centre if you're struggling with the system itself. Within the resource centre, there are a couple of resources that are quite useful. So there's an interactive how to use capacity tracker guide in there that has in-depth information around RAG rating and that kind of stuff as well. And then separately, there is a how-to guide as well. So there's separately for care homes and hospices, and then there's small crib sheets around specific bits of the care home. So how to register for care homes, how to register for community and acute providers, then how to update your business continuity. That one's quite useful as well. Very self-explanatory, goes through each box in turn to tell you what that box entails and the kind of information you need to input in there. So they're in the how-to guides, and also how-to guides and resources. Going forward, there are some video guides that are being included, which will be quite helpful as well going forward. And for London, which I can't see at the moment on here. Oh, here we go. There's London regional guidance as well if you scroll down to the bottom. So there is going to be, as we move forward, more and more information for London regions for specific information that you guys might need.
Thanks,
that's
Hassan.
everything, Sanjit.
Thanks, Hassan. Chris, are there any questions coming through on the chat box?
Yes, we've got a few. So back to the infection control questions first. So one of them is around restricting workforce movement, so people who work in multiple care homes. So if you have staff who also work for other care homes, or your people you don't know if they work for other care homes, what do you put for that? Because you obviously can't account for people's movements at all times.
Again, that's a good question. Let me just so I think it's up here. I think you're going to have to give it the best answer that you can potentially give. This is the main question. The main reason behind that question is so the national team, so ministers as well, in the Department of Health can have a good understanding of how much of an issue that is, especially if you go through a second surge. So again, give it the best guess in terms of the answer that you can give, or potentially get into contact with these staff if they come into your home to do a shift, to understand how much they are moving around care homes. Unfortunately, the reason they've done it yes or no is because then they can report on it much easier, and it's easier to fill out, but also it doesn't allow for these discrepancies. So best guess, unfortunately.
Cool, thanks. A question about if we've had to dispose of the recall swabs, do we say no for the tests at present?
I'd say so. If you've been struck by the challenge we've had around testing, then I'd say yes. I'd say yes. Write that as a no. Yeah.
Great, thanks. Some people have asked who their clinical lead is. I will email you separately if that's the case, because it's obviously different for every care home. So another question. I complete my ADAS return daily. Is this what's being asked of us? So Sanjit, you've spoken a bit about Capacity Tracker and Market Insight Tool. Can you just say that again, please?
Yeah, so just for the purposes, and no, we recognise that there's two tools in London at the moment, Market Insight Tool, which has been commissioned by London ADAS, and we've got the Capacity Tracker tool. For the purposes of, in line with the national guidance, every care home provider has to input into Capacity Tracker, and this is the information that's being used nationally and is linked to the Infection Control Fund. So I know London ADAS through the Market Insight Tool are collecting information, but the national government guidance is everyone has to complete the Capacity Tracker. I recognise some of the questions in Market Insight Tool and Capacity Tracker are similar, but for the purposes of the grant money and the outbreak questions, this Capacity Tracker is mandated for everyone to use.
Cool, thanks. Someone says, I've tried to submit many times, and in one of the sections, I always get an error message and told my return's not been accepted. So we'd say contact the contact centre for that, right?
Yes, please. Those kind of technical issues, please get into contact with the contact centre. They'll be able to kind of run through the technical issues with you and fix them. So yes, please. And if you're struggling to get a response, again, go through the system champions and we'll deal with that personally. But the contact centre in the first instance.
I'll put the phone number in the chat box, and also we've got a slide at the end with contact details on, so we'll show that at the end. Another question, does the time of completion matter? So we've been asked to do it at different times of the day. Does it matter what time?
Nope, whenever you find the opportunity to do it, as long as it's every day, whenever you can fit it into your day.
Cool. Someone says, is this information shared with the CQC?
No, this information isn't shared with the CQC. So what we have in the Capacity Tracker is we have what we call an API, which is a transfer of information from the CQC into Capacity Tracker, purely around the names of Capacity Trackers and their CQC rating, which enables us to complete the Capacity Tracker. There is no information going back to the CQC at all.
Yeah, and I just want to highlight, none of this information is used for performance or regulatory purposes. This information is being used locally, regionally, nationally to support the response and to direct resources to you when you need it.
Brilliant. So relating to that, doesn't the tracker put care homes with a lower rating at risk of not getting placement?
I think that's up to the person that's looking at the at the care home. We just list it by location, and then it's purely objective information that's included in there. It's up to either the acute trust or the social worker, whoever is looking for a placement, to then look at the care home.
Yeah.
Brilliant. Thanks.
Chris, yeah. I'm going to jump in because I think there's quite a few hands raised up at the moment. So just want to give opportunity for others to ask the question. So I'll go with Eastwood Lodge first.
Yeah. Okay. We got a couple of questions. The first one, with the testing, what is the guidance on the testing? Do we have to do it? Because we've got a kit and we did it once for the residents and all the staff. Do we have to do every week? Do we have to test everyone every week?
So you will need to go back to your local authorities and CCGs to clarify the guidance.
Yes, please.
Yeah. So yeah, that's what I would advise.
Okay.
Yeah, so your local authorities and CCG should be able to give you that information.
Okay, all right. Second question. We have been, so this is a capacity tracker. There's another one we've been filling in every day, apart from the weekend when there is no one in the office. It's others.
Oh yes, it's just what I've I'll just repeat again. So there's 2 tools in London: Capacity Tracker and Market Insight tool. The Market Insight tool is the London ADAS one, but this is Capacity Tracker. This is the one that's been nationally mandated for all care home providers to input as part of the COVID-19 response. Every care home provider must be inputting into this tracker, and this is also linked to the Infection Control Fund grant money as well.
Okay. All right. Okay. Thank you.
So we have to do. So this one, we have to do the ADAS as well as this one.
I know. Well, I mean, it depends on your local arrangements. We can only speak for the National Capacity Tracker one. That one has to be completed.
Okay.
Okay. I'm going to go to.
Sorry.
Sorry, I'm going to go to. Sorry, I'm just going to go through the list of hands up. Mercy De Silva. Mercy, do you want to unmute yourself? Okay. Yeah. Hi, Mercy.
Yes. Once we put in the information, do we actually submit it by clicking on the submit button?
Yes, sorry, I should have clarified that. There is a submit button which I will just share with you quickly. I would share with you if I could work it out. Right, I'm struggling for some reason.
Okay, shall we come?
I'll do that in the background while you
Sorry, can I just say, if you go down to the very bottom of the screen, it says save all. You just have to press that.
Yeah. Thank you, Nicola.
Oh, good. Okay, thank you. I've done
Thanks,
that.
Nicola. Thanks. Could we go to Kathy Meacham? Kathy, if you would like to unmute yourself. Okay, I think Hassan's just going to show. Wait, it was sharing the screen. We'll go to Margaret Morris. Margaret, you put your hands up. I think, Margaret, you need to unmute yourself. Or if not,
hi,
we'll go
sorry.
Hi, Margaret. Hi.
Hi, London Borough of Bexley Quality Assurance. Just a question, really. Our providers are completing the PAMS ADAS return and the capacity tracker, but we're keen to have an update as to when you might be amalgamating the questions which are more detailed on ADAS to the capacity tracker, because they really are helpful for the local authority as far as actually supporting our providers with PPE and testing.
Yeah. Sorry, at the very beginning of this session, I'll just give an update for those who weren't able to hear it. So there is a solution that's being worked on to build an automatic feed from Capacity Tracker into Market Insight tool, so you don't have to complete 2 tools. But unfortunately, we can't give any timelines at the moment because that's still being worked on. But I appreciate it is. I know it's painful and it's time consuming for care home providers to complete 2 tools, but we are working on it. But I'm afraid I can't give you the timescales at the moment.
Sorry, so are you envisaging that people will still be, those that are completing the ADAS PAMS will continue, but the detail will be then updated on the capacity tracker?
So I can only speak for Capacity Tracker. You will have to refer to your local authority leads around the London ADAS tool, but certainly in line with the national guidance, every care home provider must complete Capacity Tracker.
No, I know. What I'm asking is when will that be amalgamated, or when will the questions from the ADAS be included on the capacity so that you don't have to complete both?
Yeah, so that's being worked on. The solution is trying to work on a solution to do that. It's all very technical. It involves building these complicated APIs. So unfortunately, So unfortunately, I can't give the timescales at the moment, but we will keep everyone posted on the developments around that API. I'm just going to move on.
Quick one, Sanji.
Can I ask a question, please?
Yeah, just 1 second. This is a save all button at the bottom.
Okay.
We are looking at kind of putting one at the top because some people have missed it. We don't expect you to complete this every day, so I think that's why people have been missing the save button. It's right at the bottom. Sorry, you go.
Okay.
Going back to the capacity tracker, I do save all every day, but what I wasn't aware of was when you go further up, it says download and upload template. I didn't know that I wasn't supposed to fill that in. I download it and it turns into an Excel spreadsheet. Then I
You
file
don't need to complete that one.
So
you don't need to.
You don't need to touch that at all. Once you save all, it's submitted.
Yeah, once you save all, that's something slightly different for brokerages. You just need to complete this information and press save all. That's all you need to do.
Yeah, because we are a single care home, so single nursing home. So I don't need to complete that. I've been doing extra then.
Okay.
You're doing it right. Yeah, you don't need to worry about these. Yeah.
Perfect. Thank you so much.
All right.
Okay, I'm just going to take one more question. I'm just conscious that we've only got 4 minutes left, and this is a couple of things I just want to relay again. But if you've got any specific questions, can you put them in the chat box, and we will get back to you. The last question I'll just take is from Sean Healy. Sean, do you want to unmute yourself? I think you're back on mute again, Sean. Okay. Okay, Sean's not coming on mute. Okay, I'm just conscious we've got 3 more minutes left. Is there one more question on the chat box, Chris?
Yes. So if there's no changes and no one has COVID symptoms, even then should we update daily? And the answer to that is yes.
Yes.
Even if nothing has changed, then you still have to log in every 24 hours and update. But it should just be clicking one box to say nothing's changed. So it shouldn't be.
Exactly. Just scroll down to the bottom and just press save. Brilliant. Yeah. Really easy.
Sorry, before we finish, I left some on the chat box. I left some questions. Are you gonna go back to me, or I was gonna have?
Yeah, so if you leave them on the chat box, we will have your details and we'll respond to you.
All right.
Just leave them in the chat box. That's no problem. So I am going to draw this session to a close, but I have been asked just to kind of reiterate the message around the Infection Control Fund and the deadline of 26th of June. So for those care homes that haven't yet completed the return, and Hassan's gone through the questions, if you could do that as soon as possible on Capacity Tracker. It has to be done on Capacity Tracker to be for you to be eligible for the grant funding. And I think there's still a high number of care homes that haven't as yet updated on Capacity Tracker, and the local authorities can only make that allocation of funding if care homes have updated Capacity Tracker at least once and are completing it on a consistent basis. I'll take back the question to the national team around what does consistent basis mean, but for the purposes of this, if you could update on a daily basis, that would be great. And I know the national guidance for the Infection Control Fund is a bit confusing, but we will get some clarity for you. So that all needs to be done before the 26th of June. That's next Friday. I'm conscious that we've had such a great turnout for this webinar. This session is being recorded, and we will send the link around for people if they've missed any of the topics. We are planning to run some more sessions because of the demand, so we will probably do them at an Sdp level, so we'll be in touch with you in the next week to kind of just share some dates for further sessions. So that has been an ask from some of the people on the webinar. I think Chris has kindly put up a slide around your Sdp lead contacts. Obviously, these are the Sdp leads. There's 5 SDPs in London, but you will have your local system champions who should be able to respond to you if you have any queries in the first instance. If you have any technical queries, please contact the contact centre support for Next CSU, and I think Chris, my colleague, has already put that number in the chat box for you. But these are the key contacts for Capacity Tracker across the SDPs. If you aren't getting any responses from your system champions, please go to your Sdp leads in case you don't get a response. I think, was there anything else I missed, Chris and Hassan?
I don't think so. Just to say, if you don't know who your clinical lead is, then either email your local system champion or email the person in your STP in this table, and they'll put you in touch with the right person. So it depends where you are. But no, I think that's everything.
Okay, thank you. I'll draw the session to a close. Thank you all for participating, and have a wonderful Friday afternoon. Have a good weekend, and we'll be in touch again, and I'm sure there'll be some more webinar sessions for you to join. Thank you. Bye.
Thank you.
Bye.
Thank you for joining.
Bye.
Bye.
Bye bye.